The image shows a whiteboard listing common diuretics and antihypertensive drugs, their generic names, trade names, and typical dosage forms or strengths. Here's a simplified breakdown. 1. Diuretic fluid retention and blood pressure. Furosemide, trade name Lasix, dosage form tablet, strength 40 milligrams. Indapamide, trade name Idatix, dosage form tablet, sustained release SR, strength 1.5 milligrams. 2. Antihypertensive drugs for lowering blood pressure. Ramipril, trade name Ramiril, dosage form tablet, strength 2.5 milligrams. Losartan potassium, trade name Osazet, dosage form tablet, strength 50 milligrams. Atenolol, Tratenoloc, dosage form tablet, strength 50 milligrams. Bisoprolol, trade name dosage form tablet, 2.5 milligrams. Propranolol, Traderol, dosage form capsule, strength 80 milligrams. Amlodipine, Amlotab, dosage form tablet, strength 5 milligrams. Methyl dopa, trade name Dopamet, dosage form tablet, strength 250 milligrams. Prazosid, name Alphapress, dosage form, dose strength 1 milligram. Explanation of use. 1. Diuretics help eliminate excess salt and water from the body to manage high blood pressure and edema fluid buildup. 2. Antihypertensive drugs work in various ways to lower blood pressure, including relaxing blood vessels, e.g. Ramipril, Losartan, Amlodipine, reducing heart rate, e.g. atenolol, bisoprolol, propranolol, controlling nerve signals affecting blood pressure, e.g. methyldopa, prazosin. This chart is a simple guide for healthcare students or professionals to understand commonly prescribed medications for hypertension and related conditions. Let me know if you want details about any specific drug. Yes, you're absolutely right. Here's a more detailed explanation of the drugs mentioned and their unique characteristics, especially with the context you provided. Methyl 1, methyl dopa, Dopamet. Purpose, used to treat high blood pressure, especially in pregnant women. Why it's preferred in pregnancy. Methyl dopa is one of the safest antihypertensive drugs during pregnancy due to its minimal risk to the fetus. It reduces blood pressure by acting on the central nervous system to relax blood vessels. Side effects: fatigue, dry mouth, dizziness, and in rare cases, liver issues. 2. Amlodipine, Amlotab. Purpose: a calcium channel blocker that helps relax blood vessels, making it easier for the heart to pump blood. Helper drug, often used as part of a combination therapy for better blood pressure control. Commonly prescribed alongside other antihypertensive drugs like ACE inhibitors, e.g. Ramipril, or diuretics, e.g. Lasix. Side effects: swelling in the ankles, flushing, or mild headaches. 3. Furosemide, Lasix. Purpose: a loop diuretic that helps the body get rid of excess water and salt, commonly used for edema due to heart failure, liver disease, or kidney issues. High blood pressure in combination with other drugs. Mild side effects: dehydration, electrolyte imbalances, e.g. low potassium, dizziness, and increased urination. Confusion with kidney issues. Furosemide can sometimes mimic symptoms of kidney disease due to its side effects, e.g. dehydration and altered kidney function tests. It's crucial to monitor kidney function and electrolyte levels when using this drug, especially long-term. Other important notes. 1. Combination therapy. Drugs like amlodipine and furosemide are often used together in resistant hypertension or heart failure to enhance efficacy. 2. Pregnancy considerations. Methyl-dopa is the go-to for managing high blood pressure in pregnancy. Amlodipine is not the first choice, but can be used when methyl-dopa isn't effective. 3. Monitoring. Furosemide requires regular monitoring of electrolytes, potassium, sodium, and kidney function. Patients on amlodipine may need to manage side effects like fluid retention. These nuances are crucial for ensuring effective treatment and minimizing risks. If you'd like, I can also elaborate on how these drugs interact or their specific role in combination therapies. Combination therapy is a common approach in managing conditions like hypertension, high blood pressure, or heart failure, especially when a single medication monotherapy is not sufficient. Here's an in-depth look at how drugs like amlodipine, furosemide, and others mentioned earlier are used together for better results. Why use combination therapy? 1. Enhanced efficacy. Combining drugs with different mechanisms of action lowers blood pressure or treats related conditions more effectively. 2. Lower doses, fewer side effects. Smaller doses of multiple drugs often cause fewer side effects compared to high doses of a single drug. 3. Target multiple pathways. Different drugs act on distinct parts of the body to control blood pressure or reduce fluid retention. 4. Address resistant hypertension. Some patients don't respond well to a single drug and need combination therapy for adequate control. Examples of drug combinations and their roles. 1. Amlodipine plus losartan potassium. Why combined? Amlodipine, calcium channel blocker, relaxes blood vessels. Losartan, angiotensin receptor blocker, ARB, reduces hormonal signals that tighten blood vessels and retain sodium. Benefit: together, they lower blood pressure more effectively and reduce risks of stroke and heart failure. Common use: primary or resistant hypertension. 2. Amlodipine plus furosemide. Why combined? Amlodipine reduces blood pressure by relaxing arteries. Furosemide, loop diuretic, removes excess fluid, reducing pressure on the heart and lowering blood pressure further. Benefit: particularly useful in patients with hypertension and edema due to heart or kidney issues. Watch for: monitor for fluid loss, electrolyte imbalances, or excessive drops in blood pressure. $3. Ramipril's amlodipine. Why combined? Ramipril, ACE inhibitor, blocks the production of angiotensin II, relaxing blood vessels. Amlodipine adds an additional vasodilatory effect by blocking calcium channels. Benefit: effective for severe hypertension or preventing organ damage in diabetic and hypertensive patients. 4. Methyl-dopa plus other antihypertensives, e.g. amlodipine or diuretics. Why combined? Methyl-dopa works centrally to reduce nerve signals that increase blood pressure. Adding amlodipine or diuretics addresses peripheral mechanisms, enhancing blood pressure control. Pregnancy-specific. Methyl-dopa is safe during pregnancy, but may be combined with others if pressure remains uncontrolled. 5. Furosemide plus ramipril losartan. Why combined? Furosemide reduces fluid overload. Ramipril or losartan relaxes blood vessels and reduces salt retention. Benefit: commonly used in heart failure to lower preload, fluid buildup, and afterload resistance in blood vessels. Caution: careful monitoring is needed to prevent kidney dysfunction, as both classes affect renal blood flow. Advantages of combination therapy: improved outcomes, reduces complications like stroke, heart attack, and kidney damage. Synergy, drugs with complementary actions work better together. Reduced dose-dependent risks. Lower doses reduce risks like cough, ramipril, or swelling, amlodipine. Considerations when using combination therapy. 1. Monitoring. Blood pressure. Ensure it doesn't drop too low, hypertension. Kidney function, especially for diuretics and ACE inhibitors ARBs. Electrolytes, watch for imbalances like low potassium with diuretics. 2. Tailored regimens. Combinations are adjusted based on the patient's condition. Heart failure, furosemide plus ACE inhibitors ARBs, beta blockers. Resistant hypertension, amlodipine diuretic plus ACE inhibitor ARB. 3. Patient-specific factors. Pregnancy, methyl-dopa is preferred. Others like losartan are avoided. Comorbidities. Diabetics may benefit more from ACE inhibitors ARBs. Potential risks in combination therapy: hypertension, excessive blood pressure drop leading to dizziness or fainting. Drug interactions. Some combinations, e.g. furosemide and ramipril, require close monitoring to prevent kidney damage. Side effect amplification. Swelling, amlodipine, or fatigue, beta blockers, may worsen when combined with other drugs.
Conclusion?
Combination therapy is highly effective for managing complex conditions like hypertension and heart failure. Drugs like amlodipine, furosemide, losartan, and methyl-dopa complement each other when used strategically, improving outcomes and reducing risks. However, careful monitoring and personalization are essential to ensure safety and effectiveness. Let me know if you'd like to dive